When do you use Tylenol or acetaminophen? What really is a fever? And why do we give acetaminophen? Well, fever is based on age and temperature. In an infant less than 2 months of age, any temperature over 100.4 is considered to be a pretty high temperature. Infants typically don't act very sick. They may not eat well, they may spit up, be a little more irritable. But a temperature over 100.4, you definitely want to consult with your healthcare provider. In older kids, a temperature over 101.5 is considered to be a fever. Now, fever is just a manifestation of an illness or an infection, and it's the body's way of fighting the infection. So some doctors don't recommend using acetaminophen to fight a fever because it kind of blunts the immune response. Our goal, though, is to make the child comfortable, and you can use things like a warm bath, increased fluid intake, and it's not typically necessary to use fever-fighting medication. Motrin or ibuprofen is not recommended in kids less than 6 to 9 months of age because it can cause some gastric upset, and it definitely will blunt the immune response. So as long as the child's comfortable, you don't necessarily need to fight the fever. But again, you want to consult with your healthcare provider if your child has a temperature, especially in an infant less than 2 months of age with a temperature over 100.4 to 100.5. In other videos upcoming, we'll talk about measuring temperature. There's many ways to measure, and you can look forward to that video. We'll talk to you soon. This is Dr. Jill Robertson at NoCryingBabies.com.